So my topic was for lecture was to review the research done for intradiscal PRP and stem cells. Stem cells are allogenic autologous stem cells, and it was very important to discuss those studies because very recently we had the warning from FDA about the allogenic products. And the problem with allogenic products is there are a lot of products that are not really very well controlled. That doesn't mean that products are not good, but we really don't know what we are getting. There is no way you can confirm that. So allogenic tissue, whether it's umbilical cord or amniotic fluid or expanded cells in the laboratory, it's always difficult to really find out what you are actually getting into. I'm sure these all are doing a good job, but the allogenic cells are not patient specific. These are not patients' own cells, and because of that, there is a lot of ethical issues, a lot of immunological issues, that rejection and things like that. That's why I personally very big supporter of the autologous stem cells, which is taken out from your bone marrow. You concentrate and then you inject it. And we discussed the studies about the what is out there about the autologous stem cells. This is the first abstract, was published 10 years ago at the Orthopedic Journal of 6 patients, very positive results, 3 men, 3 women, and 6 months follow-up, and had a significant decrease in the pain score, and the procedure was safe. So it was safe and it was effective. And then this is a true randomized controlled trial, came out from Hospital for Special Surgery from New York under Greg Lutz, is very well-known clinician, scientist, and has published well. This was a 47-patient, 29 treatment and 18 control, and the trial was 6 months, 1 year. And then he also updated with a 2 years outcome. And the outcome was very, very positive, very, very safe. And since this article came out, actually that inspired me to start doing the PRP intradiscally. So one of the studies that I really comes to our mind, and most of physicians who are using the bone marrow stem cells for spine, they all must have read this study. And this study is, his name is Kenneth Patin, and he's an orthopedic surgeon. That's why it's very important to realize that even surgery, the physicians from surgical background also do believe that autologous stem cells are very effective. In that study, he has 26 patients, and he followed for 5 years. And out of 26 patients, only 6 patients went for surgery, and 20 patients did not require surgery. Now, all those 26 patients were on the surgical list to have surgery, either fusion or disc replacement. So you can say, you can see the 20 patients did not require surgery, means it's a huge difference, and it's a very, very encouraging outcome, because that is our goal, is to really, what can we do to minimize the extensive surgery. And I think the regenerative medicine is the option, not just help you symptomatic relief, but also can help you to change the course of the disease. And what I meant by that is that it slows down the progress of the degeneration, and it creates the regeneration of the tissues. So you really, you get what you are looking for, is to address the root cause of the degeneration. And so I think the studies that we have, unfortunately, are small sample size, and there is always some bias there. Products are not very standardized, different patients, and so problem is the level of the evidence that we have so far is not very high level. It's level 3, which is kind of low level evidence. But still, one thing that come across very clearly on all the studies, those who use the autologous bone marrow stem cells, is the safety, because these are your own cells. So when you use your own cells, you don't have to worry about the rejection. You don't have to worry about the immunological problem, patient specific. Nobody so far has any tumor or anything like this. So as a pain physician, so much involved into regenerative medicine, I can tell you this is our future. And this will at one point help us to reduce all the extensive surgeries that we do for joints and spine would be less and less, because we will be addressing the root cause very effectively. Now this is another scientific review where there are multiple studies were reviewed, kind of meta-analysis. And the review was very positive. PRP stem cells are potentially can affect and change the and very positive, and it's safe and effective. These are the list of, it's very maybe difficult to read, but this is list of the studies that reviewed in this article, and you can see the different number of patients, the volume they used into the disc, volume of blood, number of injections, and so this is a very well done study, and they also pretty much it's a very safe, effective, very positive study after the review. This is another latest systemic review, is an intradiscal injection of PRP for lumbar disc is effective. And in these 5 studies, the 4 showed the level 4 evidence and only 1 showed level 2 evidence. So I think there are plenty of studies that have level 2, level 3 evidence, but we still have not achieved what we really need to achieve in terms of producing the study. So I think the problem is these days is that somehow in last 2 decades we have focused too much on evidence and level of evidence and interpretation of evidence. It is all changing. For example, I have not seen, there is no level 1 or level 2 evidence for spine surgery. There is no sham, there is no blinded surgery that you can really call it level 1 evidence. And it is difficult. It is not that easy because one study will cost you millions of dollars. But evidence is there because there are so many studies have been done, though small size, sample size, but there, which is different than the studies you do as a randomized control trial, because then you have to be part of the IRB approved study. So that is happening. But because the autologous bone marrow falls into category of 361 product, where you do not require the requirement of the drug investigation, new drug investigation protocol, meaning that if you are not manipulating the drug, you are not digesting the drug, or you are not expanding the cells, then you can just concentrate the bone marrow and inject into the disc, which is a homologous use. So that's why we can use it. There is no federal regulation to stop us doing this. And same thing applies for the PRP, which is platelet-rich plasma or protein-rich plasma, where you take your own blood and you spin it, so we are not really digesting anything, which is slightly different when you use the autologous cells from your adipose tissue, where you take the adipose tissue and you digest enzymatically to get the stem cells. But for that, because you are digesting fat, you have to have a study protocol. So if I want to use the SVF, stromal vascular fraction taken from the adipose tissue, and inject in the disc, I cannot do it unless my patient is on IRB approved study. This, I found one study, it's a very positive study in terms of improving the range of motion or improving the ODI pain score, where patients had PRP with SVF. This is a series of 15 patients, very positive results. This is the issue right now is there are so many scammers out there, and they promote this drug as a snake oil that you can fix everything. You can fix Alzheimer's disease, you can fix the Parkinsonism and things like this. I think we have to be very careful. Being a physician, you have to have evidence and some kind of way to really promote it. And if we cannot control those scammers and those people who are giving a bad name then we will have a big problem. And problem is, this is such a beautiful, wonderful science that we can use to help the mankind will be lost, because then will be, we will lose the trust of the public, because everybody will start making money. I know people who are doing this, wrong kind of practice, charging thousands of dollars and no good outcome. That will not help us. So I think the FDA warning is not to really stop you doing the right thing. There was never any intention. Intention is to make sure that you do the right thing and don't get into, because science is science. You have to really understand that. So if you do something that is not been proven not effective, because the complication has been reported are disastrous. Somebody lost the eye, somebody had the tumor in the spine, somebody become paralysis, and that's by doing the things that they are not supposed to do. If you follow the guidelines, you follow the protocol, you look into what includes the 351 products and what includes 361 products, then you will be fine. But people are going a little bit of out of control in that sense, because they are making money. And unfortunately, the stem cells becomes very, sexy term for public, that, oh, I'm getting stem cells, without realizing what you are actually using, what kind of cells. And really, when you get a product from outside, there are no live stem cells. This is why if I market on my website or in my practice that I'm using the stem cells, and if these stem cells are allogenic, I have to be very careful, because there are no cells there. It's a bunch of protein. This is why they are changing the names, to exosomes and microvesicles and different names. The only place you really have stem cells is from adipose tissue and from bone marrow. Even then, we don't call it stem cells. We say mesenchymal stem cells in a part of the term, but those terms are also changing. The mesenchymal stem cells name was given by Arnold Kaplan, a scientist from Cleveland, in 2006, and we used to call it mesenchymal stem cells. Just because of it's not the live stem cells, we are actually now calling it a medicinally signaling cells that stimulates and activates the resident stem cells when you inject them. So we are learning a lot, and I hope government also understands the difference between the real science and the scammers who are practicing, and curtail the illicit practice. Then I think we'll be fine.